My name is Colleen Dussex, and I'm doing the case study review comparing my case study with Mrs. D and a pulmonary embolism with Samantha's nose case study with Mr. MS with an ischemic stroke. Samantha's patient suffered a blood clot, where Mrs. D suffered a pulmonary embolism, which is a blood clot in her lung. Her patient suffered an ischemic stroke, which is a blood clot in the brain. Both patients are similar in age. My patient is a white female and Samantha's patient is a black male. Both patients have atrial fibrillation, a dysrhythmia of the heart where the atria do not contract properly and the blood in the atria does not empty completely into the ventricle, causing blood pooling in the atria and clot formation. While Mrs. D had warfarin held for a medical procedure, Mr. MS had aspirin held for a dental procedure, and both patients were in a hypercoagulopathic state, increasing the risk of blood clots. Mr. MS had a rapid ventricular rate of 123, while Mrs. D had a rate-controlled atrial fib rate of 84. Both Mr. MS and Mrs. D had similar risk factors, including age, atrial fibrillation, high blood pressure, and hyperlipidemia, risk factors for blood clots. But Mr. D was also a smoker, which is a huge risk for blood clots. He's a male, which increases his risks. He was a diabetic, which also increased the risk of blood clot. He had a family history, and he was African American, which increases his risk for blood clots. Mr. MS had a higher risk for morbidity and mortality associated with blood clots, which is a higher chance of having a blood clot and a higher chance of dying from a blood clot. Mr. MS had unknown onset. He was found outside. Nobody knew when it started, while Mrs. D was within the 3-hour time limit, and she was able to receive thrombolytics. Mrs. D had witnessed collapse, and they administered the thrombolytics within 15 minutes. I think Mrs. D thrombolytic administration gave her a better resolution of the blood clot and less residual damage related to the blood clot, but the ischemia associated with the cardiac arrest and the decreased perfusion resulted in a multi-organ failure, that despite being able to resolve the offending clot, she still suffered a poor outcome. If she had had the pulmonary embolism at home, even if it was witnessed, Mrs. D would not have survived the event. The facility I work at does patient education on stroke alert for every patient that's seen in the hospital, whether they're there for toe pain or open heart surgery. The people are informed of the importance of time and signs and symptoms of a stroke. It's emphasized that they don't simply blame it on stress or sleep and go to bed. So many people just go to bed at night and think if they still feel bad in the morning that they'll go see a doctor. But with the time frame for stroke, it's important to seek medical care right away. If Mr. MS had been educated on the importance of time frame and the symptoms of a stroke, I think he probably would have had a much better outcome. And thank you very much, and that's the end of physiology. Have a good year.